I'm Alex Tao, an acupuncturist here at Serenity Spa Natural Health Clinic. I specialize in pain, anxiety, and stress. In addition to those things, I also specialize in facial cosmetic acupuncture. Today, I'm going to be demoing this. So the first thing we do is we put in some balancing points to help ground the patient's energy before we put needles directly into the face. After putting the balancing points in, we can go ahead and proceed with facial cosmetic acupuncture. The first thing I do is I put an astragalus and geranium skin prep onto the patient's face. Arnica gel is good for preventing bleeding and bruising. And since the face has a lot of small capillaries, it's really important to help try to reduce bruising as much as possible. Unfortunately, slight bruising is a side effect, but it'll go away in a few days. Now we are done prepping the patient's face, and we can go ahead and start inserting the needles.
What are the effects of the facial?
The facial helps to reduce lines and fade kind of like the effects of aging on your complexion. It also helps to clear blemishes and other marks on the face. I have patients that it works on acne, skin tags, rosacea, people that lines next to the eyes, crow's feet, and then lines on the forehead as well, among many other things. So this is now we're done putting the needles in. So we let the patient relax for 20 to 30 minutes, and then we come back and take them out.
Does it work to help with fine lines and blemishes?
So there's a lot of different theories, but I say that it helps to draw the body's attention to that area. So like the kind of how acupuncture works is the needles increase blood flow to wherever they're put into. So by putting the needles into the face, it brings more blood flow and therefore more oxygen, more nutrients, more platelets, everything the blood carries to that area. So it kind of accelerates the healing process in the face or like brings healing processes to the face that normally to areas that normally wouldn't go to as much. Also helps the body to heal itself and kind of fix certain things in the face.
If there's a blemish, do you put the needle directly in, like a spot?
Depending on the type, like if it's like an acne pimple, I wouldn't put the needle directly into the pimple, but I would surround it. Things more like just redness or like a line or a scar, I might go directly into it. Okay, so now that we've let the patient rest for about 20 to 30 minutes, we can now take out the needles. Sometimes when the needle's taken out, there's a small droplet of blood that comes out. It's perfectly normal. What I do is I take a little cotton swab and then gently dab it.
People generally see immediate results?
Personally, I usually see an effect immediately after the treatment, from what I think. Usually everyone has their own personal opinion about what their face looks like, but yeah, I would say that there is immediate effect.
Do you recommend a series?
Yes, usually I recommend a series of a total of 10 treatments 2 times a week, so 5 weeks. This is to ensure that we get at the maximum effect, and that when that you're coming in, and that we can get see you more regularly and not have any breaks. And then after the initial 10 treatments, we kind of do before and after, and then we can fully assess the amount of change. After all the needles are removed, we then do the facial astragalus and geranium prep wash one more time. This is a yin balancing facial serum. It's a serum meant to help give nutrients and moisture to the skin after treatment. I'm going to gently massage the serum into the face. How do you feel, Nick?
Beautiful.